waking up to find out that your little one is mouth-breathing because they're struggling to breathe through their nose due to a stuffed nose, or what we call catarrh, would you want to relieve that before taking them to the hospital? Then stay glued to the screen. Hey beautiful people, welcome back to Life with Ria. If you're new here, you're welcome. My name is Gloria. I'm a wife, a mom, and a doctor, and I bring the medical perspective into the care of your little ones while building a wholesome family as well. So people talk about newborn essentials, back to school essentials, but nobody really talks about toddler essentials, because we both know that our toddlers are very active. They also have a compromised immune system, which predisposes them to contacting different illnesses fast. Most times we don't know the first thing to do before taking them to the hospital. Well, in today's video, we are going to be talking about 10 items that should be in your home before your toddler falls ill. The first one on my list would be to address what I talked about earlier in the video. I've had times where I've woken up and my daughter had stuffed nose. And the first thing I did was to drop 2 drops of nasal saline in each of her nostrils. As uncomfortable as this might be for them, because my daughter struggles, oh my goodness. This thins and loosens the mucus in their nostrils, helping it flow, giving them an immediate relief. The second thing I will talk about is nasal aspirator. This helps get the mucus that has loosened out of their nostrils, for those of them that might still get stuck in there. What we do in Nigeria is that we use our mouth as the nasal aspirator, because as mothers, we want to give them an immediate relief. Like, you just don't want your child to be uncomfortable. So if you can provide the help, you will provide the help, but that isn't advisable because a lot of bacteria can get into your mouth. The third one would be a thermometer. Thermometers are so important. That might even be number one, but we're not doing this in order of priority. Thermometer helps you know the degree of temperature that your child has in the case of fever, that is increased body temperature. Once it is more than 38 degrees Celsius, I would advise that you immediately go into the fourth one, give paracetamol according to the prescription on the syrup paracetamol bottle. Then take your child to the hospital so that they can treat the cause. Sometimes you don't even know that your child is running a temperature of 40 degrees Celsius, and that can lead to seizure. So having a thermometer helps you record that and give an immediate relief. That is the paracetamol. Then take them to the hospital. What a lot of mothers do is that they give the immediate relief, and once the fever dies down, they don't bother going to the hospital. And 90% of the cases, the fever comes back up. So you are just treating the symptom, you're not treating the cause. Another one would be the ORS, oral rehydration sauce. Most times what we do is that we give our children juices or plain water. But once they vomit or have diarrhea, they have lost electrolytes. This oral rehydration sauce help replenish those electrolytes that have been lost. The next one on the list would be bandage. All these cute little bandages for little scratches, because these people are active. They be climbing the windows, the bed, everything that you can put your foot on, and they're not really careful. So sometimes they can fall and have a scratch, or even when they go out playing with friends, they can fall. It's good that you have a bandage to immediately seal that up so that it doesn't get infected. The next on our list will be Vaseline, or as some of you might say, petroleum jelly. It helps with dry skin, diaper rash, skin rash. Another essential thing would be triple action cream. You should always have the triple action cream at home because it helps clear any rash. If the rash persists for more than 3 days, please do take them to the hospital, because it might not just be a regular fungal rash. It might need serious medical attention. I don't even know where we are at this point, but another thing would be oral syringe for medications, especially our syrup medications and our suspension medications, because these toddlers be using us as punching bags whenever we try to give them their medications. So this helps you take the correct meals and put it straight, yes my dear, you into their mouth so that they get everything without pouring it out. It's so essential. Another one would be your mini first aid box that contains the spirit. Yes, it's me. Yes, Mama, I'm going. This is a no-brainer. You should have this at home. One that contains spirit, cotton wool, band-aid, the wraparound bandage, just in case, the plaster for deeper cuts before taking them to the hospital. The last one would be a mini medication box. It's not realistic to keep my medications high up, especially since my bathroom doesn't have a medication cabinet that is high. So what is advised is that you get a mini medication box and store all your medications there and lock it. Then the bonus point, the controversial topic on the net concerning toddlers would be cough syrup. It's not advisable to give them cough syrup. One, because most times cough syrup makes them drowsy. Toddlers can't cough out the mucus. They are ones that cleans the mucus. They are ones that helps them get it out. But getting it out is something they can't do. So it thins it out and it tries to get it out, but they can't. So they swallow it back. So what is advised is that you use alternative measures like honey, hot water, steam bath. These have proved to relieve my daughter's cough a lot of times more than the cough syrup. So we've come to the end of this video. I had to rush it because my daughter is with me and she won't let me breathe. And I just heard that my newborn is awake. So I need to go attend to her. I hope you enjoyed this video and you picked up one or two things. Kindly send it to someone that you know might need this, a mother, an auntie, your cousin, your sister, and let them grab their essentials now. Don't forget to like, share, and subscribe. And if you would like me to do more of these medical essentials for toddlers, please do let me know in the comment section. In case I might have missed one or two things that you have at home, please do let us know as well in the comment section, and I will see you in my next video.